All right, class, let's talk about lymphatics. So, what's the lymphatic system? It's actually a unique system in the body, and it's unique because it belongs both to our immune system, it helps us fight off disease, and it can help, it actually spreads disease because just of the way it works. And it also is part of the circulatory system, which is like our bloodstream. It helps to carry off excess tissue, fluid, and waste, as well as help fight disease processes. So the four major components are the lymphatic vessels, the lymph itself, which is sort of mostly plasma and water, the lymph nodes, which you're feeling when you're doing your head and neck exam, and then we have some separate lymphatic organs. We've already talked about one of those organs in the past, known as the thymus, which kind of breaks down as you get older. It's large, it's in the center of the chest, and that is where the T cells mature, which is part of our immune response. So that's one of our lymphatic organs. So the lymphatic system itself, it's a network of vessels. And these vessels are really, really hard to see. So if you've ever seen them do an autopsy, you can make out blood vessels very easily and veins and arteries. But lymphatic vessels themselves are like see-through, they're like clear. And the fluid, for the most part, that runs through them is also clear. So you almost never see them on one of like the models that they show of the body or during autopsy. So these vessels themselves that carry the lymph are interconnected with the lymph nodes. And lymph nodes are all over our body. They're not just in our head and neck. You know, they're in our chest, they're in our guts, they're in our groin, they're everywhere, down our legs. These little bean-shaped nodes exist all over the body, and they can be superficial, meaning like close to the surface of the skin, or really, really deep within our body system, like within like the guts. They're really deep. So when we're palpating, you know, you can't feel lymph nodes. The doctor really can't feel lymph nodes that are really deep in your guts because they're protected by the organs. But the superficial ones and then the deeper ones of our neck, you can feel just because, you know, the neck isn't all that thick. So the vessels themselves contain a colorless fluid known as lymph. And the lymph vessels follow the veins of the body. So usually we talk about arteries, nerves, veins running together, but also these lymph vessels run with the veins. They're like kind of next to the vein, and just the way the blood moves through our veins and the way blood moves through our veins, we have valves within our veins, and the muscular contraction of us moving and just living and breathing and doing all those things gets the blood to kind of get pulled up. Additionally, we have the help of the heart to move blood up. Lymph doesn't have, it's a pressureless system, so it really relies on, you know, our diaphragm contracting, our muscles contracting to pull the lymph up towards the heart, to the larger lymph vessels that are closer to our heart. So just know that those vessels run alongside our veins. Very difficult to see. And lymph itself is a clear fluid that carries nutrients and waste materials between body tissues and the bloodstream. So how does lymph form? So this is actually quite fascinating. So here we see, excuse me, we see an arteriole, we see a venule, and then the yellow, all these little yellow areas, these are lymph vessels. So when we start to talk about capillary beds where nutrients, waste, and oxygen are exchanged within cells, right where the arterioles, those really, really, really small arteries, and the venules are really, really small veins, the circulatory system is considered mostly, it's closed, except at the point of the capillary beds where cells want to receive the oxygen, get rid of the waste. So there it's open, and right at that point is where half, maybe even a little bit more than half of the fluid that's released from the cells, the plasma, gets sucked into the lymph system. So this is how it is part of the circulatory system. So right in those capillary beds, we're sucking up, the venules are sucking up the deoxygenated blood and the nutrient waste of the cells, and the lymph vessels are also sucking up the plasma at this point. And the reason why it does that is we have to get rid of the excess fluid that leaks out in our tissue spaces. That's one of the reasons. And if you've ever been like on a long haul flight, like a really, really long flight, and you kind of get up and you feel that swelling like in your feet because you've been sitting down for so long, it's because, like I said in the prior slide, we need our muscle contraction and muscle movement to be pulling the lymph, to be pulling that excess tissue, that plasma out of the tissue spaces. And when you're sitting for a long period of time, you can get that swelling because the lymph system kind of gets impacted by us sitting for a long period of time. All right. So, and the other reason, which is great that this happens, is part of the immune system. So because for the most part that the circulatory, our blood system, our bloodstream is a closed system, things like diseases, infections that get into our blood, right, they can spread rapidly throughout our body. So, half of that fluid is getting sucked into the lymph system, going through our lymph nodes that act as a filter to get rid of those infections. So this is good that our total blood volume, 2 to 3 liters of it, I think we have 8 liters of blood, like 2 to 3 liters of it is lymph at any given time, meaning it's going through the lymph nodes. The lymph nodes are detecting their guards to prevent infections from getting out of control and spreading throughout our bloodstream. So lymph nodes, they kind of feel like little beans, like kidney beans that you see in chili, except they're not as squishy. And for the most part, if you're normal, you're healthy, you shouldn't be able to feel lymph nodes. And within the lymph nodes themselves, they contain a white blood cell known as a lymphocyte. So the lymphocytes within the lymph nodes protect or fight off infection that is detected when that 2 to 3 liters of plasma that's always circulating through the lymph system, the lymphocyte's job is to detect if there's an infection or they need to fight a foreign invader. So there are about 400 to 700 lymph nodes in the body. And of course, like we're all different. And there's all kinds of literature about, oh, there's no lymph in the brain, and now there is literature, there is lymph in the brain, and so it's changing all the time. Just know we have a whole heck of a lot of lymph nodes in our body. About 170 to 200 of them are located in our head and neck. We want to keep that brain clear of any kind of infection. So we have double barriers around the brain called the blood-brain barrier to prevent things from getting in there. Because if your brain gets infected with a bacteria or protozoa, that is bad news for you because that could be a terminal illness. And then, oh no, I'll save that thought for a minute. So what do the lymph nodes do? So they're filtering the lymph fluid. So the lymph fluid passes through them as they're making its way back up towards the heart, right? Because everything is coming back towards the heart. So the head and neck lymph nodes are draining down towards the aorta, and the vessels beneath the aorta are getting pulled up by that contraction of muscles. So if the lymph nodes are filtering the lymph fluid, they're trapping bacteria, other microorganisms that shouldn't be in there. They're producing some lymphocytes within them, and they're keeping waste products and microorganisms out of our bloodstream. So you could think of them as the lymph nodes, and then the lymphoid organs act as a type of filter, like the pool filter. Have you ever looked at a pool filter that's catching all the leaves and the bugs and the dead squirrels, right? It's removing them so that you can swim in the clean, clear water, just so it keeps your blood clean and clear. So you don't really have to know this. So how flow and drains of lymph nodes. So the lymph fluid enters the node via the afferent vessel and it exits the node via the efferent vessel. Very similar to, remember how we talked about how the afferent is a sensory part, goes towards the brain, enters the brain. The efferent exits the brain, it's the motor component. So this is the same kind of language. And the knowledge of the location and drainage area is important when tracing spread of infection and or cancer. So if you've ever known someone that has had cancer and they've had an operation to remove a tumor, they're always taking lymph nodes, right? Another thing that they know, like cancer of the breast is a good one. So if you have breast cancer, there are nodes that they know that are associated with cancer. So if you've ever had a breast exam and they reach up at the end really deep in your armpit, you're like, ah, right? That's your axial nodes up there in your armpit. And that is one of the nodes that actually gets affected very easily with breast cancer. So if they feel that you have a lymph node up in your armpit that is really swollen, they're going to say, oh boy, right? We know what drains into this, what drains into that is breast cancer. Another thing, if you have a node like behind your ear, sometimes that's enlarged. You might be asked, have you had a lot of ear infections, right? Because an ear infection may drain into that post-auricular node. And then deeper cancers, deeper like stomach cancer. If you can believe the stomach cancer, if they find a node up here around your clavicle or around your sternum, sometimes that is not a sign of breast cancer. Sometimes it can be a sign of breast cancer, but it could also be a sign of stomach cancer because that's how the lymph flows. As the stomach is below the heart, it's getting dragged up, right? Some of those cancerous cells are getting dragged up with it, and it affects the node that's up closer to your clavicle, could be a sign of stomach cancer. So knowing how lymph flows, it can help you decide, oh, there's a submental node here that's inflamed. There might be an abscess on 24 or 25 because those mandibular incisors drain in there. So that's why it's important. So we talked about the vessels, okay? So the vessels, they're very similar to veins, except they're different in one way. So they drain all the vessels, right, of the lymph system, empty into one or two lymphatic ducts. And then these lymphatic ducts empty into the venous circulation. So they eventually get returned back into the bloodstream, into the venous circulation. So the right lymphatic duct empties into the right subclavian vein and then into the vena cava. The left lymphatic duct, left subclavian vein, and then into the vena cava. Now, if you look at this, so we have a right and left lymphatic duct. We have a right lymphatic duct, and then we have the left lymphatic duct, also sometimes referred to as the thoracic duct. So, you know how we always talk about our body being divided in half, and this half, we're the same on either side. Well, this is a part where we're different. It's very strange in that the right lymphatic duct drains like right shoulder, head and neck, which is absent from this person. Right? But if you can envision the head and neck here in the right shoulder, right to about here, all drain into the right lymphatic duct. Everything else on the left side, here, guts, both legs, groin, all drain into the thoracic duct, also known as the left lymphatic duct. So the left side drains 3/4 of the body. The right side drains 1/4 of the body. And these are important to know because let's say you have a cancer of the head and neck. You might see lymph node swelling only on the right side because that's what's draining the head and neck. Let's say you had a stomach cancer right here, right? It's getting dragged up towards the thoracic duct, dumping in, and this up here is where you get the inflammation in the lymph node up here, where it's going from the thoracic duct and being emptied into the vena cava, back into the venous circulation. And this keeps repeating over and over again at the capillary bed level. So, spreading of disease. So let's talk about an abscess tooth, right? How does it spread, right? You get an abscess on a tooth. So the disease will spread through the lymph vessels themselves. The disease, the infection, the microorganisms will go through the lymph vessels until it reaches the primary node associated with that area of the body. So it might be for our teeth, the submental node, it might be the submandibular node, and you're going to have to know which teeth are related to which primary node. The lymphocytes themselves, those white blood cells located within the lymph nodes, will begin to multiply to combat the infection. And then the node will become enlarged. That's when you can start to feel it. And that's known as lymphadenopathy, when the node is enlarged. So the infection, so you go and you have the root canal done, the endo done, and you're treated with antibiotics, the node should return to normal size. If it's not stopped, if the infection continues, it will kind of come and pass through the next vessel and go to the secondary, and then tertiary means third node, may become enlarged in the chain as it's leading back down to get to the duct, enter the venous circulation. So if you have frequent infections, if you had frequent strep throat, frequent ear infections, sometimes nodes can become chronically enlarged. So what can you expect to feel? Nothing. They're not detectable and there's no tenderness. What about an infected lymph node? You have strep throat. You can imagine they'll be firm. They might be sore. Oh, you know when you get really big lymph nodes when you're sick with mononucleosis? They get really sore, they're enlarged, they're warm. Remember, those lymphocytes are multiplying, right? There's a metabolic process happening within the node. They feel warm. It will be on both sides of the head, bilaterally, and they're freely movable. Occasionally, especially if you've had frequent infections of the same area, the node will be permanently enlarged. They'll be not tender anymore, and they feel more sort of rubbery. So what if it's cancer? What if it's a malignancy? Now they're going to feel firm. They won't hurt. Sometimes they're matted, meaning they're kind of stuck together, or they're fixed. They're stuck to underlying tissue, and usually you can feel it on one side when it's related to cancer. Now, don't tell somebody, oh, you have cancer because this is firm and it's unilateral. The only way to diagnose cancer is to have a biopsy, right? People have different kinds of nodes, different kinds of feelings. You cannot predict that something is going to be malignant or cancerous. The reason that they feel different is because the lymph nodes that are associated with infection, that swell from infection, is because the lymphocytes are multiplying within them. The lymph nodes that are associated with cancer, it's the cancerous cell itself. The cancer cells have spread out. They have burst forth from the primary malignant site. They've traveled through the lymph system, and then they start multiplying within the lymph node. So not only within the lymph node are lymphocytes multiplying, but also the cancer is multiplying within the lymph node itself. So here are some questions to ask yourself. Where is the enlarged lymph node located? How big is it? Is there evidence of an infection? What do you think is a probable cause? Are they mobile, meaning movable, or are they fixed in position? So let's look at this lymph swelling, this lymphadenopathy, and you can see here this really large swelling in this man's the side of his neck. So it's nothing more than an increase in the size and a change in the consistency of the lymphoid tissue and an increase in the size and number of the lymphocytes. So when the lymphocytes start going crazy and multiplying to fight infection within the lymph node, they can really swell. This is what they look like when they're swollen due to an infection. I believe this person has strep throat, and that's why they have this very enlarged lymph node. And remember, it's normal when the body's fighting an infection, it's normal for the lymphocytes to multiply within the lymph node and for the lymph node to swell. So look at this large swelling. Okay, so this now we're seeing there's a cancer inside of this lymph node. The lymphocytes are multiplying, but also the cancer is growing. And this would be considered a metastasis, most likely a metastasis, because you can also have cancer within your lymph node system or your lymphocyte system. That could be called acute lymphocytic leukemia. So sometimes you can see that in lymph nodes, but if there's only one node involved, sometimes this is a metastasis, which is the spread of the cancer from the primary site. So when you have a metastasis with cancer, when it is spread from its primary site, let's say from the stomach, and now you're feeling it up towards the neck and lymph nodes up towards the neck, that means that your prognosis, your survivability of that cancer is lowered because now it is in your bloodstream, it is in your lymph system, it's passing through different lymph nodes, it's passing through different organs. So lymphoma is a cancer of the lymphoid tissue. The manifestations are similar, and there are some that occur. They are Burkitt's, histocytic, Hodgkin's disease, lymphocytic. Um, I'm not going to ask you to know those. We're not oncologists, right? There's probably many, many, many more types of cancer of lymphoid tissue, and these are a few, but just know that you can also have cancer of lymphoid tissue known as lymphoma. Oma, O-M-A, at the ending of the suffix of a word means tumor. Tenderness, if it's sore, or if it's not sore, that doesn't mean that one, it's in general, okay? In general, if one is if it's not sore, makes you lean more towards a malignancy, but again, not always. Don't tell someone they have cancer. So firm but rubbery could be lymphoma, soft nodes, most likely infection, shoddy nodes, which means it feels like multiple buckshot size. Buckshot's really tiny. It's almost like a BB pellet, right? So if you feel multiple BB pellets, usually that's from a virus. That might be more of like the mononucleosis. Tonsillar tissue. All right, so clusters of lymphatic tissue are located in the oral cavity and the pharynx. And remember, also in the back of the tongue, that lingual tonsil. We talk about all of these as a protection, right? So the front of your tongue is tasting, but the back of your tongue and your throat is sensing. Is this a microbe? Could this hurt me? Could this be an infection? Before you swallow it. They are not located along the lymphatic vessels, but they serve as barriers between the outside world and inside. So these are located in sort of close to all of our openings through our nose and our mouth and our throat to act as protectors in case there's something infectious that we are swallowing. So all tonsils drain into something called the superior deep cervical nodes, and they are called palatine, lingual on the tongue, pharyngeal, and tubal. And the tubal tonsils also known as pharyngeal tonsils are also known as adenoids. So the palatines are located between the anterior and posterior tonsillar pillars. So palatine tonsils are the ones you're used to looking at, right? They're in between those pillars. It's what you're looking at when you tell someone to say, ah. The lingual tonsil is the lymphoid tissue located at the root of the very base back of the tongue. The adenoids are on the posterior wall of the nasopharynx. That's good, right? Blocking things that we're breathing in that could be infectious. And then the tubal tonsil is located in the nasopharynx posterior to the openings of the eustachian tubes. And all of these tonsillar tissues form a ring. It's called Waldeur's ring. So it's the 4 tonsillar structures as well as other small collections of lymphatic tissue dispersed throughout the lining of the pharynx, acting as sensors to figure out, is something I'm swallowing or inhaling infectious, and then creating or acting as a barrier or as a filter to those things. Now let's look at some superficial nodes of the head. So we're going to be talking about lots of nodes. So many nodes, it's going to drive you crazy. So superficial means close to the skin, right? That's not deep in our guts, close to the surface of the skin. So we have occipital, back of the head, retroauricular, behind the ear, anterior auricular, preauricular, in front of the ear, superficial parotid, a little bit more forward than anterior auricular, and then facial. So let's look. Occipital. So it's right near the protuberance. It drains the occipital portion of the scalp. The occipital nodes empty into the superior deep cervical nodes. So let's say here, right, sometimes like right at the hairline, you might have like a little pimple and you've picked it and it gets infected. And now there's an abscess form. So that infection will first drain into the occipital nodes because they're located right here. Then from the occipital nodes, they will then drain or reach the superior deep cervical nodes. They'll go into nodes in the neck. Cervical means neck. Retroauricular, now that's behind the ears. It drains the mastoid region, earaches, ear infections usually will go into, as a primary node, the retroauricular nodes, and then drain secondarily into the superior deep cervical nodes. Anterior auricular, front of the ear, skin of the ear, temporal region. Now these drain into the superior deep cervical and the superficial parotid nodes. Superficial parotid is superficial to the parotid gland. It drains the parotid region and the anterior auricular nodes, and these also empty into the superior deep cervical nodes. In one of the Word documents I attach for weekly work, what are we on, 12? You'll see all the different areas and what's the primary node it goes to, what's the secondary node, and then finally what's a tertiary node. Facial node, right? So there's 3 separate facial nodes: orbital, below the ear, buccal, at the cheek, and mandibular. And these all empty the facial nodes. Let's say, I don't know, you had a piercing of your, sometimes people pierce their dimples like in their cheeks. So let's say you had a piercing in your cheek and they used a contaminated, I don't know, needle. I don't know how they actually do it, but if they use a contaminated needle, you get an abscess there. The infection will spread to the facial node, and then it will drain into the submandibular node next. And those are one of the nodes that we feel, along with a bunch of others, right? Superficial nodes of the neck. So we're on the superficial of the head, the ones that are very close to the skin surface. And now we're going to talk about the superficial nodes of the neck, the ones that are close to the skin surface. Those are our submental, submandibular. Involvement of the above nodes indicates an oral pathology. There's an abscess somewhere in the mouth, submental and submandibular. We also have superficial cervical, superficial anterior cervical, and posterior cervical. Submental, that's the one where you're putting your thumb underneath your chin and feeling, right? So what does it drain? It drains the chin, the lower lip, anterior floor of the mouth, apex of the tongue, and the mandibular incisors, 24, 25. So you have an abscess on 24. It will spread the submental node, not treated, it will go to the submandibular nodes, and then finally it drains into the superior deep cervical nodes. As it is spreading, right, and you're not treating it and you're getting more and more nodes, right, the risk is running that this infection is going to enter the venous circulation where one of the thoracic ducts, the right thoracic duct, dumps into the vena cava. So we're trying to prevent that from happening. The body is trying to capture the infection and fight it through the lymphocytes within the lymph nodes. Submandibular nodes, inferior border of the mandible. Now this drains a lot. Cheeks, upper lip, body of tongue, anterior portion of hard palate, floor of mouth, sublingual, submandibular glands, all teeth. It drains all the teeth. So it's an abscess in all the teeth except for 24 and 25 mandibular incisors in the maxillary third molars, 1 and 17. I'm wrong, 1 and 16. Submandibular nodes. So you have an infection in tooth number 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It will drain into the submandibular nodes first and then into the superior deep cervical nodes. Superior cervical is also known as the external jugular node. So that's located along the external jugular vein, drains the parotid area. So this node will then drain, it will either go into the superior or sometimes the inferior deep cervical node. Superficial anterior cervical, it's along the anterior jugular vein below the thyroid cartilage. It's anterior to the SCM. It drains the infrahyoid region, and these drain into the inferior deep cervical nodes. So let's look at the deep nodes of the neck. So they're more extensive. There's a whole bunch of them, 15 to 30 of them. And they're located along the length of the internal jugular vein, deep to the SCM. They're divided into superior and inferior, and you saw up there some of them drain, like the superficial anterior drain into the inferior deep, and the submandibular drain into the superior deep. And how do we decide which one is superior and inferior? It depends upon whether they are located above or below where the omohyoid, remember that one? Oh my shoulder hurts. The omohyoid muscle crosses the internal jugular vein. So you can see here in this dissection, here's the omohyoid coming down here to attach to the scapula, going up here to attach to the hyoid bone, the internal jugular vein. So any of the lymph nodes above this area where it crosses the vein is considered superior deep, and then below would be inferior deep. And the deep nodes of the neck are secondary and tertiary nodes for other head and neck nodes. Oh, I already talked about this. Omohyoid, right? Infrahyoid pulls the hyoid bone down. Internal, external, and jugular veins, we'll talk more about these next time. So these are drainages for the brain. So let's look at superior deep cervical. So the superior deep cervical, it's on the lateral surface, so on the outside surface of the internal jugular vein, below the anterior border of the SCM, about 2 inches below the ear. So these superior deep cervical nodes are the actual primary nodes for maxillary third molar teeth, base of tongue, posterior hard palate, soft palate, posterior floor of mouth. So you have a cancer, it's like oropharyngeal cancer, the base of your tongue. It's going to drain directly into the superior deep cervical nodes. And then it will drain from superior deep to inferior deep, or it will go right into the jugular trunk. So superior deep cervical are secondary nodes for occipital, retroauricular, anterior auricular, superficial parotid, submandibular, superficial cervical. Tertiary nodes for submental and facial nodes. It's tertiary because the submental and facial nodes will first drain into the submandibular and then the superior deep. Inferior deep. So it's about 2 inches above the clavicle, located on the lateral surface along the anterior border of the SCM. It's a primary node for posterior scalp and neck, superficial pectoral region, and portions of the arm. It empties directly into the jugular trunk. These nodes may also communicate with the axillary lymph nodes in the armpit. So important to know. The minimum nodes you should palpate during the extraoral exam are the superficial and deep nodes of the neck. To detect abnormalities such as enlarged lymph nodes, the structures must be compressed against a firm underlying structure or between the examiner's fingers. Lymph nodes are best palpated using a bilateral circular compression. Question. So what's the primary and secondary nodes that could become enlarged with the following? Toothache abscess, tooth number 3. Primary node is going to be submandibular. It's not 1, 16, 24, 25. So it'll be submandibular. Then it will be superior deep cervical nodes. Lesion on the lateral border of the tongue. Lateral border of the tongue, same. Submandibular, superior deep cervical nodes. Lesion on the middle of the lower lip. So I'm thinking lower lip, right in the middle. What's directly beneath that? 24, 25, that's submental node. Primary is going to be the submental, then it will go into the submandibular. So please review the 2 Word documents that were copied and put on weekly work 12.